Hey, Hanover Township Police Chief Mike Loock. Chief, we've heard a lot about ARRIVE and the importance of ARRIVE. Could you please take the floor with your team and explain to us what ARRIVE is and why is it important? Thank you.
Thank you, Mayor. So ARRIVE is an acronym. So it stands for Alternative Responses to Reduce Instances of Violence and Escalation. So here in Morris County, we have the ARRIVE Together program. So what it does is it partners law enforcement with mental health clinicians to be able to go out proactively to respond to instances, to serve the public, to get them resources as close to the time of the incident as possible. So here in Hanover, we have a clinician in the building on Fridays. That's our assigned day. We've been doing this since October of 2024 here in Hanover. We've been fortunate enough to have that relationship. Before it started here in Hanover, it was a county program in 10 towns, Madison being one of the first ones. So as soon as it was kind of brought to our attention, I immediately called Chief Misha and asked him how the program was going, and he said, hands down, one of the best initiatives that there is. So as soon as we were given the opportunity to get on board, we took every opportunity that we could, and it's been great ever since. So part of what that does is it's the outreach. As Mr. Kelly said, it's the connectivity part of this. So our liaison to the ARRIVE program is the school resource officer at Whippany Park High School, Paul Weaver. It's not by accident that we chose Paul Weaver to have this job. So he is fantastic at it. He has gone to more training than we can imagine to implement this and have it succeed in the high school, but also for the general public here in Hanover Township. So in the calendar year of 2025, we had officers submit 70 referrals to the ARRIVE program here in Hanover, while also having 40 co-responses from our clinicians. So we've had over 100 instances where we have put this program to use. It could be from calls for an emotionally disturbed person, to a domestic violence incident, to a missing person, or to a death of a family member. Those clinicians are out there. Even when they're not here on Fridays, we are calling them to come from other towns to be able to provide those services. So it's been a great resource for the officers to have that clinician there with them and being able to get those services as close to the time of the incident as possible. So within Morris County, this program has been led by Chief Assistant Prosecutor Meg Rodriguez. So she's going to go into a little bit of how the program started statewide here in Morris County, but because of Meg's dedication to this program, she was awarded the County Prosecutors Association of New Jersey with the Outstanding Advocacy Over a Career in a Non-Trial Position Award, mostly for all of her work in this ARRIVE program. So this is the second time I've gotten to embarrass Meg with that, reading that award out. So I knew she wouldn't tell everybody, so I wanted to make sure that she does get credit for that. It's a testament to her hard work for the ARRIVE program, for every municipality that is afforded this program, and obviously the dedicated work that goes out to the public that it's serving. So Meg, it's all yours.
Thank you, Chief. I appreciate that. I really love and adore being embarrassed, so that was great. Just briefly, because Chief already talked a little bit about really what the program is. It's a far cry from what we initially thought it was going to be. It initially started in Cumberland County as an initiative between their state police and their screening unit, because they wanted to try to get screeners out to incidents where there was a mental health crisis quickly. So that's how it started, and they recognized that one of the big issues that occurs when somebody is in crisis is that there's a higher likelihood or potential for there to be a use of force on the part of law enforcement. A lot of times it's just simply unavoidable. You might have to put hands on somebody to get them into the ambulance if they don't want to go. And unfortunately, as we're all very familiar with, at times those incidents can escalate even further. And obviously, nobody anywhere wants that to happen. So it showed some success down in South Jersey, and then the Attorney General's office started saying, hey, let's move this out throughout the state. So we were approached here in Morris County and said, hey, listen, how do you want to do this? We want to put this program out there. What do you think is going to work for your county? So we're like, whoa, let's figure this out. And they were like, well, slow down, not exactly how you might want it to work. There is a certain structure. It can either be co-response, meaning you have a police officer and a clinician in the same car responding out to those crisis incidents. Or it could be a close-in-time response, meaning the clinician can follow the officer, whoever that officer is that catches that call, to the scene and respond that way. Or it could be telehealth, which we didn't think was going to be the best idea. Or it could be follow-up, meaning if an officer responds to somebody who is in any form of mental health crisis and feels that they would benefit from connections to services, that the officer would then submit a follow-up referral form, and then the clinician would be able to literally follow up on that and the next day or as quickly as possible. So we're like, well, why do we have to settle with or? What do we think is going to work best? And we were reaching out. Chief Misha was definitely heavily involved in this because Madison was already looking at trying to do a co-response program. We spoke to a number of the chiefs to try to figure out how is this going to work for your officers. Because ultimately what we saw is not just worrying about the potential use of force and not just only worrying about an incidence of an emotionally disturbed person. But we're recognizing that our officers, when somebody calls 911, they are called upon to be the experts in everything. Whether it is obviously regular policing, showing up to a car accident, investigating a homicide or a sexual assault, getting a cat out of a tree, whatever it is, they're expected to be the experts. And when it comes to mental health crisis, they were also expected to be a clinician, a counselor, somebody who could psychologically diagnose somebody. And you know what? That wasn't fair to them. It wasn't fair to them, and they shouldn't have been put in that position. So we're like, what can we do to help our officers in those situations? So we're like, can we do the close-in-time or a co-response model plus the follow-up to try to get that off of their plate so they don't have to be the expert in that arena? And that's how our program here in Morris has evolved. And I can say, you start talking about numbers, there's a couple numbers that I could go through, and one is on my phone I get the alerts along with MHA for any time the comm center calls out a call that might be a mental health related call, and I wasn't trying to not listen to Tracy because it kept buzzing. And I wanted to see how many just in the last 10 hours. There were 10 in the last 10 hours. 1 an hour at least. And there are days that this phone is buzzing like there's no tomorrow. That's what our officers are facing and dealing with. So being able to assist them with our Arrive program has hopefully been a great asset. And we initially started in Morristown, Madison, Morris Plains, Morris Township, Roxbury, Denville, Randolph came afterwards. And initially 8 towns, and then we came here to Hanover because clearly here in Hanover there's a significant need with the variety of populations. And now we've moved over to East Hanover, we've moved over to Florham Park, we've moved over to the Chathams. So we are actually countywide at this point in time, with the exception of Victory Gardens. That's my job for 2026, and to get everybody on board because we want to make sure everybody can get these services out to them. But one of the key things that Arrive does assist with is youth. Because if you have somebody who's having a psychiatric emergency and the screener goes out, they can't really go out for a child. You need to get perform care. You need to get family crisis intervention to try to get out, and then you need the parent to agree to that. Arrive will help with all ages. And what I do find striking about these numbers is a lot of times we are seeing like really young kids to the aged. So we deal with everything from juvenile issues to Alzheimer's, dementia, you name it. Whatever the officers need help with, our Arrive clinicians will go out and assist with. So as far as numbers, to close on that, as far as connections that we aim to make, right now, Morris County, we started the program in 2024. The program itself started in 2021. And if you go to the Attorney General's website, there is the Arrive data dashboard. And you can see how many, as of January 5th, that's where we're at this moment as far as their dashboard. There have been over 15,000 Arrive interactions throughout the state. We started later. We initially started with 8 towns. We added Hanover, we added Randolph, and then just went countywide this summer. And Morris County alone accounts for 2,357 cases of the 15. And the reason for that is not necessarily that we have that much more, mentally challenged or crisis people dealing with those types of challenges. Really, why our numbers are that high is because our officers have bought into the program and are making those referrals and really trying to connect people to services that they need. So I appreciate any credit that I get as far as my involvement, but I can't take that credit because really the credit belongs to the police officers who are on the streets and dealing with these issues, and the co-responders and MHA who are actually out there and connecting with everybody. So I appreciate the fact that the towns have been so supportive. We look forward to trying to help as many people as we can and to try to help our police officers do the best job that they can as well. Thank you.
Chief Mischer, would you like to add anything to that?
Well, I'm not going to embarrass Meg. I've done it a couple of times myself. Yeah, the Arrive program is, we've been on several panels for the Arrive program, and it does a fantastic job. I actually looked up our numbers in Madison before I came here to talk about connections. But for 2025, we had 170 total Arrive incidents. I didn't break down the follow-ups and responses, but the year prior, we had about half of that. So we're using it. Officers really bought into it. It works. Our use of force, I think the year prior when I looked at it, use of force for any Arrive related calls were zero. We didn't have any. So it's a great program. It's working, and Megan and Mike heard me say it's a no-brainer that we have this program and we utilize the program, and we couldn't do it without the prosecutor's office, MHA, the sheriff, so and our local officials. So thank you,
sir. Sergeant Kilmer, do you have Arrive in Bayonne or a program similar?
Yes, actually, I'm the Arrive liaison for Bayonne. We do the co-respondent and we do the follow-up also. We have Arrive in our town. We have mental health screeners 2 days a week. We're lucky at this point to have that. It's, like everybody says, it's a fantastic program. You're responding to a call of a mental crisis, if it's suicidal, something like that, with law enforcement, with a mental health screener there also. So you're bringing them right to the scene, and it is making a huge impact. With that, with Arrive, we have crisis intervention training too. The crisis intervention training is a 40-hour course, and it's for the officers and the screeners to have a better understanding of what somebody in a mental crisis is going through, and that it's a great impact on the officer to understand that more, to get that additional training to understand what somebody might be going through. And I think it's a great program. I'm sure you guys are utilizing that too.
Meg's our coordinator for
I love my CIT classes. And yeah, we do have CIT. Chelsea's been there. Tracy has taught there as well. And it's I think one of the other keys to it, again, this keeps going back to this connection theme. It's not only helping the officers and the clinicians understand what somebody in crisis is going through. What I think one of the keys is that it helps the officers understand how the screeners are dealing with it and other mental health providers are dealing with it, and how mental health providers get to understand what officers are facing and how they are dealing it and why they are dealing with it in the ways that they are. Because a lot of times you have, sometimes here, especially here in Morris County, we are resource rich. That is what they call it. We have all of these things, but nobody knows how to interact with each other. Nobody understands each other's jobs, and everybody's in their own silos. So our CIT classes, which are open to any advocates for people involved with families with mental health concerns, it really helps everybody understand how to best treat anybody who is in crisis.
Go to the connection word. I just added probably about a dozen contacts into my phone through the CIT training from every aspect of what we're dealing with, from the supervisors of the mental health screeners to 988, M-Court, to aspects of homeless shelters and things like that within our county. And that's what is going to help this program, by having the resource, by being able to make contact with that person and getting the person help.
Chief Locke, you want to close out this portion?
So I think everybody can kind of clearly see that this is a very successful program, but it is the partnerships that we do have through the police department and the schools and the mental health associations that are able to provide these services. And I think it helps everybody involved, especially the community that we're looking to provide resources to. So if anyone has obviously any questions for those resources, this information will be pushed out, but by all means, please call either the prosecutor's office, or your local police department, or obviously through your schools to help connect on those resources. So thank you, Mayor.
Hey, I just want to say thank you very much for bringing this program to us, and thank you very much for all the great work you do. Thank you.